So my report was on burgers, also known as IgA nephropathy. An 18-year-old male diagnosed with Crohn's disease underwent a hemicolectomy 2 years previously. He had maintained a state of Crohn's disease remission with a 5-aminosalicylic acid treatment. 4 months prior to referral to the nephrology clinic, he experienced non-bloody diarrhea. He simultaneously developed proteinuria and microscopic hematuria with deterioration of renal function. Based on renal biopsy findings, the patient was diagnosed with crescentic IgA nephropathy. Immunostaining for interleukin-17 in renal tissue and previous exacerbated colonic ulcers was positive. Steroid pulse therapy was administered, followed by high-dose glucocorticoid therapy. The patient's renal function recovered and his gastrointestinal symptoms were alleviated. What is Buerger's? Buerger's is one of the most common forms of glomerulonephritis. It's a disorder in which the glomerule gets clogged by protein buildup. Immunoglobulin A is the protein that builds up. When there is a defect in IgA, it causes the antibody to attach and form clumps. There's a special sugar that is called galactose, and it's in your IgA. So then when there is a deficient in the IgA, the sugar is also going to be deficient. So it's going to form clumps, and it's going to get into that glomeruli and can cause complications such as liver disease or failure. Signs and symptoms. Some of the signs and symptoms are high blood pressure, high cholesterol, proteinuria, cola or teal-colored urine from the red blood cells in the urine, pain on both sides of your back, below your ribs, nausea, vomiting, headaches, dry skin, drowsiness, sleeping problems, darkened skin, and muscle cramps. So there are many causes as to why someone will get Buerger's. And some of them are genetics. Some families might have a family history of the disorder, so there's a higher chance that that person will get Buerger's. Age, so like teenagers and people in like their mid-30s are more likely to get it. Ethnicity would be like whites and Asians are more likely to get it than African Americans. Men are twice as likely than women to contract Buerger's. Liver diseases such as cirrhosis, hepatitis B and C, they all cause Buerger's in one's body. And then something called celiac disease, and that's when someone eats gluten, and the gluten can just make your body somehow contract Buerger's. Diagnosis. So for diagnosis, we can do a few tests. We can do blood tests, urine tests, the estimated glomerular filtration rate, a kidney biopsy, serum, creatinine test, blood pressure, and cholesterol test. The blood will show increased level of creatinine, and the glomerular filtration rate. Normal levels are usually 60 or higher, and when it gets below 60, it means liver disease, and then if it gets under 15, that's when we start thinking that they have kidney failure. So we'll look more into that. The urine will be bloody, cloudy, and it'll have lots of albumin and creatinine. Oh, right here. We want to know the albumin to creatinine ratio, because if the ratio is 30 milligrams of albumin to 1 gram of creatinine and it's higher than that, then we want to make sure that we get the patient diagnosed because they will have chronic kidney failure. A 24-hour urine will be collected to do these tests. Under the microscope, you'll see red blood cells and casts. As you can see the picture to the right, you can't really see it with me down here, but it'll be a red cloudy color. There are many treatments or many medications that the patient can use for treatments, and it's omega-3 fatty acids, and those are supplements to decrease the inflammation. Diuretics will be used, and those are to get the extra fluid taken out of the body that it's absorbing, but we want to get it out. Statin therapy just helps the patient lower their cholesterol and slow down the onset of kidney disease. And then the angiotensin converting enzyme will keep the patient's high blood pressure at a normal level and help prevent protein loss. And all these medications are just ways to reduce the risk of either having the patient go through dialysis or kidney failure. So thank you for listening. I hope you learned some stuff.